You're listening to The Q Switch with your host, Spence.
Welcome, one and all, to the Q Switch Conversations podcast. I'm your host, Spence. And the mission of this show is to tackle subjects currently impacting ophthalmology and pull in leading eye care professionals and industry specialists to discuss their unique perspectives. So let's jump right on in. Today, we have a special treat for you folks. We have Dr. Susan MacDonald, and among her many titles, she is a practicing ophthalmologist. She is an associate professor at Tufts University, pioneer, and she's the founder and CEO and executive director of iCore, which is a 501(c) organization she established in 2017, whose mission is to reduce blindness by providing vision screening and eye care, including cataract surgery and glasses for those in need, which we'll talk about more later in the show because they do so much amazing work, and we'd like to raise awareness for that cause. So, Dr. MacDonald, thanks for joining the show. I know you have a demanding schedule. We like having you on. So where are you calling from today?
Hi there, Spence. I am calling from the beginning of where the Revolutionary War started in Concord, Massachusetts.
Okay.
And what's great is tomorrow is the 250th anniversary of the Revolutionary War, which began in Lexington and Concord. And so that's where I am, right where it all began, the revolution.
Oh, well, that's certainly a little historic piece there. And you said 250 years ago?
Yeah, 250 years ago. So the towns, every year they have a reenactment of the shot heard round the world. And when this is the place where the Minutemen actually began a resistance towards the British for taxation without representation. So this is where our country started in Concord, Massachusetts.
So today's theme is ensuring continuity of care amidst equipment failures in ophthalmology. So, Doctor, over the course of your career, I'd imagine you've been in just about every clinical and surgical setting and situation where equipment didn't perform for you, most when you needed it. So, to start things off, what is one extreme example from your lived experience where this happened and how you overcame it to ensure you achieved your targeted outcome and still delivered that best patient care possible?
I think it's a great question because it's going to happen to each and every one of us, no matter where we are in our career. And I'll give you two situations. One is when I was practicing, we had a problem with the entire hospital's air conditioning went down, and then the electricity was just coming off and on. And as you can imagine, having a working microscope, having a working phaco machine, and just having the lights so people can walk around the operating room is really important. And so we actually were able to fix that, but what we weren't able to fix is when we went on our generators, we didn't have any air conditioning. At the very moment where everything shuts down and you can't, suddenly the lights are out, I think the most important thing is not to panic and to focus on the patient. Mm-hmm. Obviously, instruments out of the eye. I like to put a sterile, a small drape on top of the eye, just because when we start moving things around, I'm trying to protect that sterile field, and just until I know what's going on. The monitoring of the patient is really important because your anesthesiologist or your CRNA is losing all of their equipment as far as watching their blood pressure or watching their pulse and whatnot. So it's really where you have to start to say, gosh, like, what did we do in the old days? And Spence, you're too young, but I'm not too young. Like we used to, I know how to use a blood pressure cuff, and, so it's sort of just like stepping away and stripping it down and going unplugged. And so in that situation, you always have choices, right? And like I have told my kids, there's always a choice, and so when you're there and the situation is falling apart, it's protecting the patient, protecting the eye, and knowing that the best decision may be one of just discontinuing the surgery, discontinuing the day. And so what we did with this particular patient, we got the lighting on so I could continue doing, and we got the limited electricity on. I was able to finish my phaco, put the lens in, case went great. Patient, out they go. then we decided, okay, we're back and we're going here. So now what do we do? So we continue, taking care of patients and doing surgery. But then what starts happening without air conditioning is the humidity goes up in the room. And then that becomes, in our US hospitals, we have to have a certain amount of humidity control
Hmm.
in order to keep the bacteria count down. And
Right.
when we hit a humidity point, we really had to stop the surgery because remember, there's always a choice, right? And
Right.
why would it pay? If it were me and you were just doing this because, if there's an opportunity to be rescheduled, I always choose to reschedule.
Hmm. Hmm. So I do love that story, Doc, because I think that it's obviously an extreme case, but even in those small, minor situations where you can't figure out what it is, whether it's software, what have you, just remain calm and you'll get through it. And I totally agree that if situation is too hectic, stop the case. It's best to what do you said, retreat and fight another day, so to speak.
That's exactly right. And I think that's always something that's wonderful about ophthalmology is, and the surgeries, what we're doing, we have control over decision making. And so I think that's an important piece that you're saying. You just want to retreat and find a better day, and because you want your patients' outcomes to be good.
Well, great. Well, it certainly is great having you on the show. It really is a great opportunity to talk to somebody who I think really knows this subject well. Let's start by having you share your origin story and maybe include the light bulb moment that kind of put you on the path of where you are today with your career with iCourse.
Yeah. So I was an exchange student when I was 17 in Kenya
Oh,
and
okay.
Kenya, Africa. And so I was, young and very idealistic. And I lived with a Kenyan family for 3 months and I attended school. And part of my school responsibilities were that we had to do volunteer work at a hospital.
Hmm.
And that's where it was not something that I'm very proud of, but I used to sneak out because it was pretty overwhelming for me. So we would go, and then we were supposed to be doing, I don't know, rewrapping sterile gauze or something.
Hmm.
But there was a lot of real sadness there, right? Where we were working was actually an eye hospital. And so I had to go and I snuck out with one of my friends, one of my Kenyan friends, and then we got caught and we were hauled back in. And it was like, and obviously we got into trouble for sneaking out. But one of the doctors said to me, like, why, like, what's the problem here? And I said, I just don't, I don't have anything to give here. And she, it was a woman, said, well, that's what you need to do. You need to develop the tools so that you can do something here. And
Hmm.
so that always stuck with me about, making a difference. And, I was this very naive young girl that wanted to do good, but she made it quite clear that I needed to get the schooling and I needed to get the experience to be able to do what I wanted to do. And that was taking people's pain away and suffering away.
Well, it sounds like you were called upon and answered that call very early in life and in your career, and looks like you've never really stopped. You were pouring yourself and your heart into that work.
Oh, well, thank you, Spence, but I don't want to describe myself as this angel because I was not like total laser focused on my career and my path going. I really, it took me some time, but I think that's always the frustrating time. I know you have a daughter about the same age that I was when I went, and it's hard to realize that there's such a steep mountain to climb before you're able to have this skill set of being a
Hmm.
doctor, being an ophthalmologist, that there's this time period of you just have to work hard and put your, just focus in, but you also want to have fun because you're a young person. So
Right.
I wasn't an angel, but that woman impacted me is what I'm trying to say. That
Hmm.
I kept, it kept resonating with me as I was going through choosing what I wanted to do with my life.
Hmm.
That I kept thinking about it. So I have to give her credit for that.
Well, thanks for sharing that personal story. It sounds like you've had quite the journey. So let's face it, equipment interruptions and failures simply happen, albeit for different reasons. It could be from aged or outdated equipment, software glitches, inconsistent service and maintenance practices, and even in some cases, which you're probably familiar with, in some developed countries where there's poor infrastructure, so like weak power grids where you have to contend with rolling blackouts and things like that. And despite these often unforeseen challenges, what do you consider your obligation to overcome to achieve your targeted outcome and still deliver a consistent high level of patient care?
That's a great question. My answer has been growing. ICOR's been around for 7 years, and so internationally, at first I thought it was enough to, have the equipment there. We do SICS surgery, and that limits the need. We can't do phaco in many of the regions I'm at. We just don't have the stability of the electricity there.
Right.
There has one situation. I was in the middle of a case and we lost our electricity, and we used actually iPhones shining on the
Oh,
case
wow.
just to finish the case up. But then, as a leader in this nonprofit, I've had to make those decisions at a higher level too. Like once it happens to you, after you've created a safe environment for that one person, then what you do is a root cause analysis. Like, how did this happen? Will it happen again? And if it does happen again, could we have been better prepared?
Right.
Right. And so, I always look at these mini disasters as like, this is a learning opportunity for us.
Mm-hmm.
And one of the things that we do now is wherever we go, we identify where we can rent a generator. Originally, we were going to buy a generator and pull it around with us, but then
Mm-hmm.
we decided it's better to have somebody in the community. We can spend money in that community,
Right.
and we also have a backup generator.
Mm-hmm.
And then you have to think about not only the backup generator, but you need the gasoline for the backup
Right.
generators. We have done everyone like, okay, we have the backup generator, but then we were on the backup generator for a couple of hours and then no one has gas. We have to go get the gas. So every one of those times after we, um, deal with the problem. I think the most important thing someone can do is sit down and really look at what happened and why it happened and how do you prevent it from happening, or how do you be prepared the next time around.
Yeah, and I think it makes total sense doing what I would consider like like an after action report. Like, you know what, we just went through the situation, we've resolved it, it's good. Now let's take a look back and, like you said, kind of really assess what happened and how can we be better next time and be prepared, as you say. And so over time, it evolves and you get better and better at that in those situations. So I think that makes total sense.
Yeah, and I will tell you, like we now bring the iMobile. It's a low cost microscope that we
Okay.
pack up. And they actually have a battery that will help. It will stay charged for 2 hours. So
Okay.
that's great, but that doesn't replace the generator, right?
Right.
Because that's just I also need the sterilizers to be working, etc. So it's
Mm-hmm.
another step in that direction of how can we make this a safer situation, and having that battery on the microscope does a lot of good. And then the other piece is stabilizers, right? So you have these energy when you're in a environment where the electricity is bouncing around, you can really damage your equipment if you don't
Mm-hmm.
have a stabilizer on it. We've had them made for us for every one of the places we work at. We have a
Mm-hmm.
stabilizer, and then we rent the generator, and we always make sure we have access to the gas and have somebody watching those pieces.
So let's go ahead and just break this down just a little bit. Pulling from your years of experience, what are the most common types of equipment failures you encounter in ophthalmology? And I would maybe focus more on the domestic
Yeah,
operations if you can.
absolutely. So, like, let's talk about YAG lasers.
Oh, okay.
Gosh, do I love YAG lasers. But what about when it's focusing? You sit your patient down and you're focusing on that posterior capsule, and all of a sudden you get this big ding in the lens, right? And you know that your focus is off, right? So one of the things that I do and I like to do is not start in the middle. So if there is a ding in the
Oh,
lens, it's not good. And I know that it may be that, as you were saying, it hasn't been serviced in a while, but this can, instruments can get knocked around a little bit everywhere because people are moving things around. And if your focus is off, I don't know anyone that would stop at just one, right? So you do it again, boom, again, and it hit the lens. Very nice. So again, what's the right thing to do is to stop. And then take the patient out of the room. And if there's a simple way that you can recalibrate, you recalibrate. If not, you reschedule. That's sort of how I do it with the laser, because I don't want to hurt the patient and ruin their lens just
Hmm.
because I'm trying to get them to see better. Again, yeah, capsulotomy is not an emergency. And then there's other things in the for instance, OCTs are something that make it so easy to identify um, cystoid macular edema and macular pathology. But the reality is if you don't have it, you just need to look at that macula. And one of the great parts of me being older is I looked at a lot of maculas, and so I can diagnose cystoid macular edema.
Okay.
But I would say this to my younger colleagues is that's something that skill set you need to keep up, even though many times your ophthalmology assistant, your clinic assistant will come in and say, oh, patient's 6-week post-op, they have a little blur in their, central vision. And
Hmm.
even just from the history, I know that's probably cystoid, but when you get the OCT and you see it thickened, it can be diagnosed even before you, as the ophthalmologist, walk in.
Hmm.
But you strip all that away, and if your OCT's down, let's make sure that we're all keeping our clinical skills fresh so that we're able to make the diagnosis with our 90 or, our 78.
So, when technology or equipment does go down, how do these failures impact your ability to provide timely and effective patient care?
Oh, wow. Well, it completely throws, a wrench into everything. I mean,
Hmm.
it's when something goes down, there's not only the patient flow gets interrupted, there's also the rhythm of the clinic goes down because
Sure.
everybody's like trying to problem solve and say, now what do we do? And you get a lot, people can get distracted and, everybody has an opinion. And then, so one little thing about, oh, the OCT's not working can fluster everybody, right?
Right.
So what I try to do is just make a decision early rather than later, like, okay, we're not doing the OCTs. This is what we're doing, instead of letting the chaos take over. And
Hmm.
just say, this is what we're going to do. Patients are going to come back that OCTs, but make that decision and triage quickly instead of allowing it to break down the entire system of what we're doing.
Hmm. Hmm. Yeah, I mean, I've gotten calls from doctors who, need a laser because they turn those on in the morning. They have a full, schedule, and like, Spence, can you help us out? And it can be chaotic. So I think goes back to your point earlier, like, you know what? Let's just stay calm, don't panic. Use your resources, use your contacts. Let's just get through this day, whatever that means. Even if it means canceling and revisiting under more controlled, more intent, day where we can get things together and not imposition patients too much.
Yeah, yeah, I know. And it's so interesting because when you're making decisions and you're trying to accommodate a patient, the schedule, and you're thinking, oh my gosh, I can move where am I going to put all these patients? But patient care has to just be that's how you make decisions. You have to make the decisions based on patient care, not let's just try and see if we can get through it because that's a long distance. They came all this way. I
Hmm.
think I think in explaining it to patients, I think that's the other piece, Spence, is real, if you sit a patient down and you're trying to do something, whether it's with the laser or the OCT or, getting endothelial cell counts on a patient, if it's not working, being honest with the patient is
Hmm.
really important because if they're sort of not, if there's a little bit of whispering going on and the patient doesn't know what's going on, that can be misinterpreted by
Yeah.
them as there's something really serious going on. And so I always make sure that I make my decisions pretty, like I get the facts, I make the decision, and then I turn to the patient and I present it in a way that's really honest and also focused on them. That this has, we want to make sure that, we want Spence to come in and help us out, make sure that this is firing properly before we put you at risk. And then that's the end of that.
Well, I would tell you that I think patients today are more informed thanks to the internet. That I think they have a heightened sense of awareness. And like you said, they have a better feel for what's going on in the office and if something's kind of not going right the way it should. And that sixth sense kicks in. So when you speak to them, it's like they're smarter than you have to give them more credit than you would in years past. Because they're, again, a lot more informed and they're going to know when you're putting them on, so to speak, or like not really being, as you said, honest with them. And patients, I'm sure I know, as I've been a patient in clinic before when things didn't go as expected. And I just want someone to be honest, let me know what's going on so that I can deal with it as a patient.
That's exactly right. And and it may cost your clinic, like as far as efficiency goes, you may not be generating as much that one particular day. But the last thing you want to do is to create a situation where you're actually, not providing the care that you should be providing.
Sure. And patient is obviously at the center of it all, but also the vast majority of practices are for-profit businesses, small businesses at that. So from a business and financial perspective, how do equipment failures affect the financial health of your practice and including patient retention and revenue losses?
Well, obviously, if you've scheduled patients and you have to cancel them, that's a loss, right?
Mm-hmm.
And as far as patient retention, I think patient retention is more about communication.
Sure.
Right? So I sort of feel like things aren't perfect in this world. And so when they aren't perfect, I think it's really important to label that and tell the patient that there's nothing wrong with their eye, because sometimes patients don't even know it's the machine that's broken. They're like,
Mm-hmm.
God, something bad has happened. The doctor walked out of the room. Is there something that has just happened to me?
Right.
Not this flippant thing is turning on and off, right?
Right.
So I think it's really the communication and geez, like for patient retention, if somebody says to me, look, this isn't working, like I'm not comfortable with this and
Yeah.
you're my priority. Honest to gosh, I think that creates a lot. I think there's trust there. And then I think there's also, that patient may tell a story about you and how you just decided something wasn't, that you put that patient first. And I think that's a priceless story to have a patient be able to repeat to other people, and people may come and find you because of that. You demonstrated such maturity and decision making.
Yeah, and again, I've been in and out of countless practices that have run into issues, and the ones that tend to rise above and continue to succeed with their patients are those that really provide that patient experience where the patient feels valued and respected. Whether it's a great day or a good day or a bad day, that patient still walks away thinking, you know what, that was a bad situation, but they handled it great, and I still feel like I was taken care of, even despite some of the challenges that we encountered today with the equipment or what have you. So stick to those two things, and at least in my experience with a lot of practices, value the patient and respect them no matter what, and you're going to tend to rise above the situation that you've been in.
Yeah, that's 100% true. And then the sad flip side of that is if you continue and you're not really sure, that patient and something happens, that's not good either, right? And then it becomes, well, I knew there was something, that's a bad choice that the doctor went forward when they shouldn't have gone forward. Like you just, I think it's really important. When you look at errors that happen in medicine, I spent a long part of my career sitting on our morbidity and mortality of my entire hospital. And when you look at bad events, there's always these little teeny events before the sentinel event, and there were these opportunities to stop. And it just there's this sense of we stop using our higher order thinking when we get more nervous. So I've created just a stop in my head, just Like if something's going wrong, we just stop, we take another time out, and then we kind of gather what we're doing. And I always err on the side of let's not go forward. And that's just me.
Well, I think the almost what goes part and parcel to that, Dr. MacDonald, is being a good communicator, which you obviously are, but not everyone is. So I would say any, administrator, surgeon who may be that decision maker, if they're not that good communicator, have people on your team that are, that can have that really positive patient interaction and communicate the situation in a way that the customer, the patient feels valued and respected. And if you don't have that person, find one because they are invaluable.
Absolutely. And you know what? And then I think doing the post-mortem, like after an event that shouldn't have been happened, whether it's a laser failure, whether it's, a phaco machine failure. I mean, it's really important for the leadership team and the team that was involved in it to really look and kind of figure out what went wrong and hey, maybe we did the right thing and we problem solved and patient left in a great way and we're all good. But it's what are the lessons to be learned in
Right.
that we are more prepared for it happening again. And I feel that way about complications and just life lessons, right? Like why do we
Yeah.
all can't we learn from each other's mistakes?
Of course, of course.
I'll tell you my mistakes, you tell me yours, and let me learn and let's make it safer for the patient.
Of course. So let's turn to preventive maintenance and risk management. What strategies or protocols does your clinic or surgery center have in place to prevent equipment failures?
Well, I will tell you this. I was at an institution that did a great job with that. We had, and I was at the Leahy Clinic and what we had is a laser expert that was responsible for all the lasers in the institution. And we had a maintenance protocol that had to be followed, whether it was in the ophthalmology department or whether it was in another part of the neurosurgery. All of those, we had an expert, and that was because we were a big institution. I'm not there now, so I'm in Tanzania full time. That's what I'm doing back and forth. But I really relied upon our laser expert team to set the guidelines, and that was immensely helpful because we were always regulated in the standard of care that was necessary for using lasers.
Yeah, well, as you mentioned, kind of that expert, I know that in the government space, when I visit VA, DoD, and active duty military, and again, because I'm in the laser space, they have what's called laser safety officers. And
Yeah.
they do that very job where they make sure that all the lasers, every laser in the facility is calibrated and working, to specs so it doesn't, harm patients, number one, but also to prevent failures and that the maintenance and services is right on time when it needs to be serviced. So someone like that or a company, I know that like some larger hospitals, like the ones you talked about, have like a biomed department, and there are some companies that actually offer those services as well.
I agree with you. And the other piece that we need to remember too is like our laser safety officer actually identified we had the correct goggles that were supposed to be in one room, but they were in another
Oh,
room.
right, for the different wavelength, right.
Yeah, so right. So let's imagine like your laser safety team is also protecting you, your institution or your practice from you hurting one of your employees or
Right.
hurting yourself, which so it's a complicated arena of risk, right? And the most important thing is to be cautious but also have experts that know how to manage your lasers, tune your lasers, and then certify that they are within the standard of regulation.
Well, kind of along those same lines, what role do manufacturers and suppliers have in supporting you in minimizing equipment downtime, and what does that partnership look like in your view?
I think someone needs to be responsible for it, and I think that needs to be negotiated upon the purchase of
Sure.
how are we going to follow this through. And, from my perspective, I think that's part of a service that needs to be paid for.
Hmm. Hmm.
But that's
Well,
my opinion.
Well, again, speaking to Meridian and what we do, we always give our customers an option. We actually have technicians throughout the country that we've, have factory trained to be maintain, repair, and upgrade all the different lasers we have around the country. But we also offer that same service to, say, like Tufts or Bascom Palmer, and they can send service managers to, say, Bascom Palmer and train two, three, four of their members of their team so that they can, again, maintain, repair, and spot check the equipment on site instead of having to contract with us. There's a cost one way or the other, but I think at one point you have to ask yourself what's the most efficient and cost effective and make that decision based on that.
I agree. And, I agree. And that's just has to be factored into your costs, right? That if you're going to use a laser, it needs to be safely maintained.
I agree. So when unexpected failures occur, mitigating efforts are triggered almost immediately. What steps do you take to ensure patient care is not significantly impacted? And you may have spoken to that a bit ago, but is there anything you'd like to add?
Stop. I just stop. And then that you really have to gather your thoughts. And first of all, I protect the patient. If there's an issue, I will remove the patient from the room if I think that there's a fire risk, obviously. But if it's just a matter of lights gone out or, I'm not sure this is working properly, um, I still I stop until we confirm that we go through the checklist that is usually comes with the laser of,
Right.
how to troubleshoot, right? And then I'm much more inclined to like I said, I don't see canceling as a drama because I just think you might it might be safe, but if it's not, it creates a really bad situation for you and your patient.
Yeah, the risk reward oftentimes isn't worth it. So, I mean, and I think most people will make that same decision.
Yeah.
So ophthalmology is a smaller community in comparison to other specialties, and no practice is truly ever on an island by itself. With this in mind, are there collaborative strategies with nearby clinics or hospitals to manage unexpected disruptions? And if so, how do you suggest going about forging those strategic partnerships?
Wow. Okay. So that's a really smart idea, but I think that's an administrative effort, right? And I think it's super smart and that's networking. And I do think there is this effort again of having a network, and being able to refer patients. Say I have something that isn't going to work for a week and the patient wants something done sooner, to have colleagues that I trust and I know they're going to do a good job. That's the relationships that you build over the years, right?
Sure, sure. So when you're making an equipment purchase, what factors influence your decision? And is it something like, is it reliability, service agreements, cost, or something else that may really bear on what makes sense for that purchase to be made?
Yeah. So when I make purchases now, I'm making my purchases for going internationally. So I look at the wattage, whether it's 110, 220. I look at portability, and I look at how rugged it is. I'm not looking for bells and whistles. I'm looking at things that are really simple to fix. And so that's what I look for my technology that I'm bringing or purchase. And I also like to purchase things internationally because I'm trying to help develop the Tanzanian infrastructure. And part of that is to have an ophthalmic industry grow with the ophthalmic community there.
So, final question. What is the best piece of advice you have for your colleagues when it comes to maintaining consistent patient care in the face of adversity when equipment or technology fails them? I think you may have pointed to earlier with the don't panic, but is there anything else, any other pearl that you want to leave with them today?
You know what? I always think about, making the decision to move forward. You got to really tune into your gut. And if you feel, that if you're feeling that there's a risk, then I think you should be, and you may be young, young ophthalmologists may be getting pressure from, as far as productivity goes. but
Sure.
you're never wrong by canceling something or rescheduling it. I think that's the most important thing, is to know that if you treat that patient with respect and how your mom, your dad would be treated, think about it in that way, that you'll always make the right decision.
Yeah, I think it is Hippocratic Oath, where at first do no harm, right? Is that was that it? Is it at first do no harm? And
Yeah.
it's not just surgically or medically or clinically. It's really just about, let's just stop. And not, and that's also, not, I guess, doing no harm is making the right decision to move forward or not.
Yeah, and I think, physicians need to realize that they lead that by example, and that the whole team is going to follow. And then the other piece of it is, if a nurse says something to me and they think we should be stopping or a technician says something to me, I pay attention to that as well, because
Hmm.
it's not, the worst thing to happen is to go forward and have a bad outcome. And what, these things get fixed, and you live to see another day.
Of course, of course. Well, Dr. MacDonald, you absolutely killed it. So when it comes to this subject, given your background and wealth of real world experience, you are as credible as they come. So I'm 100% certain that the folks here have been taking notes. Before we go, can you share more about iCore, the work that you and your team are doing, and how people can support the organization or get more involved?
Oh my gosh. So iCar is led by women, and we're a nonprofit. We work strictly in one country, and that's Tanzania. The
Okay.
reason we're doing that is we want to, when someone donates money, we want to make sure that we're not flying around different countries, that we're really consolidating and getting the biggest bang for our buck. We've done over 8,000 cataract surgeries.
Oh, wow.
We've taken care of over 60,000 patients. We've trained over 12 doctors. We have an MOU with the Ministry of Health, and we are killing it. And we're training residents. And so what I'm doing is, what I love about this is we are training residents and young surgeons in this country. And our last outreach, when I was there a month ago, we had a 4-week outreach with the Kilimanjaro Christian Medical Center residents and faculty. And we were able, actually, with the training we have done, that all of the surgeries were done by Tanzanians. And we've been there long enough that we have this system of
Hmm.
outreach that's really extraordinary. And I'm very proud of my team. My Tanzanian team is amazing. If people want to help, they can donate. We would love a YAG laser or two. And you know what? If they want to volunteer, we don't encourage people to come over and operate, but they can certainly come over and teach and help. We're in the clinic, and we're having a ball. We're having the time of our lives, delivering service where it's never been delivered before. And I'm very proud of my team.
Now, is there a website that they can go to donate or learn more about the organization?
It's iCor, EYECORPS.org.
Okay, and if they want to reach out to you specifically, is there an email address or maybe
It's
LinkedIn that they can reach you?
Susan at icor.org. And yeah, and you're welcome, Spence. If you want to come to Tanzania, we could really use your help.
It's on my bucket list. I've always wanted to go to Africa, and again, I want to go to Africa, like spend a month traveling around Africa, and Tanzania is definitely on the list.
Oh my gosh, yes. So come.
Well, thanks for coming to share your wisdom here on the Q Switch podcast. I wish you and your team at iCore all the best. They are truly fortunate to have you as a leader. So before we sign off, we'd like to thank Riverside FM and Passionate Media for making this show possible. That's a wrap for this episode of the Q Switch Conversations podcast. Until next time, this is Spence, and I am out.
You're listening to The Q Switch with your host, Spence.